morning, Muscatine. We just found out something that I can't do. And maybe if you're lucky someday I'll tell you what it was. But it is still March, it is still spring, and may not look like it, but we're going to call it spring. We're going to run with it. So with it being March, it is also Colon Cancer Awareness Month. And so we're out here at UnityPoint with Allison Mann, who knows a little bit about colon cancer, right?
Yes.
So, Allison, could you tell us a little bit about you and what you do out here at UnityPoint?
Yeah. So I'm Allison Mann. I'm a physician assistant. I've been here with UnityPoint for about 5 years now. The first few years were spent as a provider in the emergency department. But in the past year, just over a year, I transitioned into the surgery department. So I see patients in the clinic. I talk about screening for colon cancer a lot. And then I also assist both of our surgeons, which includes surgical intervention for colon cancer. So I'm down in the OR helping out with that as well.
So you get to slice and dice.
Yes, I do.
That's the fun part, right?
It is, yes.
It's
enjoyable.
okay. It's okay to say it's fun.
Yeah, I do enjoy the procedural part of my job.
Well, and that's, the one thing that always amazes me about stuff like this is it takes the right kind of person to be able to both be able to go into somebody's body, get out the thing that needs to get out, but still also then be able to communicate about it.
Yes.
Right? Because that's always the tough thing for like a lot of folks. As you're sitting there going, okay, maybe I need to go get my colonoscopy, right? Because I hear I'm supposed to get screened, I'm supposed to be way early. You gotta like the person that's sitting across from you, right? But you've also got to trust them to go in and like open you up.
Absolutely.
Right? And that's like a skill in and of itself. So that's great that you can do that. So when we talk about colon cancer, what are kind of like the big highlights of what people should look out for, or maybe maybe if they hear somebody talking about something, what are some of those big like milestone sorts of things that somebody should be aware of?
Yeah, so the reason that there are screening recommendations starting at a certain age is the majority of colon cancers actually have no symptoms to start with. As the disease progresses, that's when people tend to start getting symptoms, and things that usually kind of trigger concern are things related to the bowel movements, of course. So changes in bowel habits, including consistency, color, even size, abdominal pain, weight loss, blood in the stool is one that gets people very concerned as well.
Yeah, I would think so.
Yeah, well, all these don't necessarily mean there is colon cancer.
Right,
it's definitely something that means we need to investigate further.
Right. So when you talk about screenings, what does the screening process look like? Like how early should you start? Who should be getting screened? What does that look like?
Yeah, so current recommendations are that we start screening individuals at age 45. Unless there's a family history of colon cancer, and then we go 10 years before the earliest age of diagnosis in the family. So we've started screening in people even in their 20s, usually more for those family-related genetic conditions. But in general, age 45, we start screening. And there's lots of methods out there for screening, and they all kind of have their own pros and cons. But
I just thought of something. First of all, I'm 43, so I got a couple years before I have to worry about this.
Yes.
But is this the thing? There's a commercial for this stuff, isn't there?
Yes.
What
the
is
Cologuard test.
Cologuard? Yes. Is that one of the screening?
It is one of the screening methods. It is only for a certain group of individuals.
I was gonna say, to me, and this is outside looking into the medical world.
Yeah.
That doesn't exactly look like something I want to do at home, or I think I'm just gonna come in, let you guys handle that.
Yes.
I'm not gonna trust the talking animated whatever it was on that card.
Yeah, and again, Cologuard is okay for certain individuals.
Right.
The biggest thing it lacks though is the preventative aspect that colonoscopies give.
Gotcha.
Now in a patient that's going to absolutely refuse a colonoscopy, sure, we'll give it as an option, as long as they understand if it comes back abnormal, the colonoscopy is the next step anyways. So we really do push for that colonoscopy to start with. And what's nice is it's only every 10 years, as long as it's normal.
As long as
it's normal.
Yeah. Well, so I guess the little animated guy isn't all bad, because if he gets you to come in and have the conversation, that's 90% of the battle, is finding out what you need to know and taking that first step to do it. And if it takes a little animated guy talking about poop on TV to get it done, that's, I guess, what it takes, right?
Yeah, and what I tend to encourage patients is if they're interested in screening, they're hitting that age and they want to discuss the options and what they are, the pros, the cons, the benefits, risks, I invite them to come to either see their primary care provider to have that discussion or even come see me in the office to have that discussion and find out what's going to work best for them in order to give them either that reassurance that everything looks good,
Right.
or, hey, let's intervene and find something early on.
So the colonoscopy itself is one of the main screening methods, I guess I would say.
The gold standard.
The gold standard, right. So colonoscopies aren't that bad. I have had to have one, way TMI. I won't do it live on air like some other people have.
Yeah.
Promise you I won't do that. They're not that bad.
No.
I mean, it seems like it would be, but it's really not.
Yeah.
And so say you come out of a colonoscopy, what happens, I mean, not necessarily like right afterwards, of course you wake up and do whatever, but like once you get your results, what are kind of the options of what comes out of a colonoscopy?
Yeah, so obviously the best case scenario is that it was a completely normal colonoscopy. There were no abnormal findings. And if you don't have a family history, that means you do not need to worry about screening for another 10 years. If there would be abnormalities on that colonoscopy, most concerning obviously it would be a cancer or a polyp. What is nice is during the colonoscopy there can be some intervention done. A few limitations there, but polyps get removed, those go to pathology to be tested, and depending on what kind they are, how big they are, and how many there are, then determines when your next colonoscopy will need to be. Of course, if there's a diagnosis of a cancer or, pre-cancer, then that would also adjust the management. And we work very closely with our hematology oncology group in the Quad Cities and kind of come up with the best treatment possible, a combination of maybe surgery or just surveillance colonoscopies, things like that.
Well, and again, that's the nice thing, my dad had pancreatic cancer.
Okay.
And, not that they're related, but it's all about having the information.
Yes.
Right? The earlier you get the information, the more options you have,
Right.
the more you can, I'm going to say, come to grips with what you're dealing with,
Yep.
right? Because if it's a little thing, okay, great. If it's something that you're going to need to rearrange your life for, the earlier you know that, the better. It may not seem like it, right?
Yeah.
But, if you can be ahead of these things, that's, from my perspective, of my experiences, that's 90% of the battle,
Yeah.
right? Is not waiting so long that you can't do anything about it.
Yeah, we've, during colonoscopies, for people's very first colonoscopy, we've caught them early in that age 45 to 50 range and have actually identified polyps in those patients that don't look overly concerning, but when they look at it under the microscope may have a small focus of a cancer in it, and the only intervention they need is that polyp removed. No further intervention at times, just repeat colonoscopies for surveillance. But then we've also caught those people who haven't had a colonoscopy in years and now they're having symptoms.
Right.
We go in, we find something concerning, and then we help guide them on to, hey, where do we go from here to get you managed the best we can and get you the treatment that will hopefully give you a longer life.
Well, and that's another one of the great things about UnityPoint here is you guys have the ability to pull in whatever you need.
Yeah.
You've got the specialties, you've got the oncology, hematology specialists, you've got all that. So it's not like you're going to be like bouncing all over everywhere, a different facility. I mean, you may be at different facilities,
Right.
but I mean different care organizations.
Correct, yeah.
It's not like you've got to go from here to Mayo to wherever. It can all be handled
Within
locally.
UnityPoint, yeah.
Within UnityPoint, which is an amazing thing. So, as you look at the next 3 or 4 years,
Yeah.
right? What do you think are the most important things for people to really take to heart from a colon cancer conversation? Like, what are the biggies for you?
I really want them to understand that, one, the screening methods are not that bad. I tell people, a colon cancer diagnosis would be much worse than the procedure itself. The earlier we can catch something, the better for all involved, family, the patient, even the providers taking care of it. And that, again, it's a conversation. So if there are questions, concerns, come talk to somebody about it. And then know your family history. I get a lot of patients that do not know their family history, and then it's hard to then give them recommendations on what their best treatment and screening will be. So to know those things also.
Let's do that one again real quick since my magical. It's you guys calling me.
About your ultrasound?
I don't know, probably, or some other thing we're supposed to be doing probably. Okay, so. So as people look into the next 3 or 4 or 5 years, and they're, say they're that 40-ish range, kind of like I am, what are the things that you really want them to take away? I mean, obviously screening. Is there anything even like food-related, health, overall health? Like, what are the big things that you should be looking at to help, I don't want to say prevent colon cancer, but make yourself less likely?
Yeah, I mean, there are definitely risk factors associated with colon cancer. The Western diet is actually a pretty large one. We eat a lot of processed foods here, so increasing those, fruits and vegetables and lean meats, rather, the chickens, rather than the red meat is really important. Monitoring for any symptoms. Again, the earlier you catch something, the better. So if there is a concern, talk to your doctor. Smoking is a huge risk factor, as well as alcohol intake in excess. Obviously, moderation is the best, but cutting back on those things is going to be important, and increasing physical activity are all things that can reduce the risk of colon cancer.
So it sounds like, folks, I'm going to tell you, Rachel Kramer is my general, I don't know what you call it.
Primary care provider, yep.
I'm going to tell you, that's the same thing she's been telling me for, I don't know how long. It seems like these things, like eating healthy, drinking water, exercising, being active, it seems like these are all kind of like the pillars for everything.
Yeah, pretty much.
I mean, I feel like we should probably pay attention to that.
Yeah.
Not that I do, always, but, it's, in some ways, it feels like it's common sense.
Yeah.
Yeah,
really, food and exercise can be medicine.
Yeah, well, and I don't know if you've seen any of Dr. Saga's dementia presentations over the last couple of months, but he talks about the same sorts of things, right? So it's what's actually should be reassuring for us that aren't in the medical profession is you're all saying the same thing.
Yeah.
Right? Like, it's almost like the things that are going to keep your colon healthy are also going to keep your liver healthy, keep your mind healthy. It's almost like, there's a correlation between this stuff.
It's amazing that the body all works together.
It does. It doesn't seem like it should be that easy. It seems like, we should just like pop a pill and some big chemical reaction should happen and like we're okay. But
it's definitely easier said than done, but.
It is. And, I think that's one thing that the screening function helps with is it allows you to be thinking about that stuff more often than just, oh crap, I went to the bathroom and there's blood in my stool, right? Like, try to take that stress level out of it and prevent those types of instances by being ahead of it.
Yeah.
So.
And I've talked to my patients a lot about, controlling what you're able to control, and then some of the things you can't control, you do need to just put a little trust into it and trust our screening processes, and that, we are wanting to do the best for our patients. Absolutely. So when we give a recommendation, it's not necessarily to benefit us at all.
Right.
Nobody likes having a colonoscopy done. I also say nobody really likes doing a colonoscopy either. But it's not that bad.
No, it's
right?
not. And that's,
it's not that bad.
It falls into that same category as a lot of stuff that you do.
Yeah.
It doesn't matter whether it's health related or work related. If they have to pay to do it, it's not supposed to be fun.
Right.
And like, if it's a screening thing, well, that's why we're all at work, right?
Yeah.
I mean, like, we'd all work for free if it was like super fun, right? But, and this is that same kind of thing. Taking care of yourself isn't always like the most fun thing to do, but you are getting paid for it.
Right.
You're getting paid for it with preventing cancer, maybe staving off some dementia, all those sorts of things. So it's not a paycheck per se, but it is definitely a return.
Yes.
So it's been fun. Is there anything else that you can think of that people absolutely have to know? And it doesn't even have to be, I'll tell you what, it doesn't even have to be colon cancer related.
Yeah.
It doesn't have to be, I mean, it's a year, right? Like, we could call it the whatever year. Do you have anything that, like, here's the one thing I'd like you to know.
Oh, that's tough.
Oh, that's the idea.
Take care of yourself. If you have a question, if you notice something, talk to your doctor. Again, we're all here to help make people have the best lives that they can have. And so if you have a question, ask it. If there's a concern, have it addressed. I think a lot of people get into a stage of denial that, hey, it's just this, I'll be fine, I'm not gonna even mention it, but mention it. It may be worth looking into a little bit more.
You don't have to acclimate to everything.
Right,
You know, like if something's changing, be aware and be conscious and,
Yeah.
and don't be afraid to ask. And, you know, especially, you know, as you approach middle age, not that anybody in this conversation is doing that.
No.
Things do change.
Young
You know,
forever.
like, yeah, I mean, it's not like you're 20 anymore, right?
Right.
And it's mostly like you are, but not entirely. So it is definitely worth taking that time and building a relationship with your provider
exactly.
so that you can feel comfortable with those things and know that they are looking out for you.
Yeah.
And that does take a while sometimes. So get in early, get your screens, get those relationships built so that when you do need them, they're already there.
Right.
So.
Yeah.
Well, I think that's all we've got for today, Muscatine.
Okay.
So enjoy the rest of your morning and we will see you tomorrow.
Mhm.